Welcome to sunny Rotterdam. My name is Nicolas from Mieghem. Next to me is Joost Daemen. We are both interventional cardiologists in the Thoraxcenter here in Rotterdam. We are standing here in our new facility of the Erasmus Medical Center. And today we will start with a new format of preview from the Thoraxcenter in collaboration with Radcliffe Cardiology. Our aim is to preview anticipated hot topics at forthcoming cardiology and interventional cardiology meetings and offer some personal insights and expectations. At the end of the meeting, our aim is also to shoot another session on site to see whether our expectations were valid and to learn what was hot and what will remain hot afterwards. So let's talk about the upcoming late-breaking trials at the forthcoming EuroPCR meeting in Paris. So the first session will start May 22nd, Joost?
Yeah, May 22nd is a Tuesday, and actually the first day already start with the Hotline on TAVI, and I think the first trial which could be mentioned is Reboot.
Yeah, the interesting part of Reboot is that it joins one of the few trials that is comparing head-to-head one transcatheter valve design with another one. And in this particular trial, the Lotus, that unfortunately is no longer commercially available, is compared with the SAPIEN 3. It is a relatively small sample-sized trial, and it has a little bit of a peculiar endpoint because the new,
right?
Yes, so the new primary of the incidence for new pacemakers, and that is a little bit unfortunate because I think our gut feeling is already telling us who will be the winner. That said, we will also get some information on valve performance, on paravalvular leaks. So I think all in all, quite an interesting study, so definitely something to look forward to.
Yep. So next, in the same day will be a hotline session on outcomes of PCI for stable angina, and to me what strikes out here is the first large sub-analysis on Orbita.
Yeah, and I think we were all excited with Orbita, and we were also confronted with the Orbita because it's often been misquoted by people who are advocating against the use of PCI in patients with stable angina, and I think there are quite some limitations to the study, but there's also some big progress in the study. So maybe you can comment on that.
Yeah, I agree. To me, Orbita was a remarkable study with an endpoint that actually nobody might have expected. It was a small study enrolling 200 patients over 4 years. It was a study that failed to meet its primary endpoint because I hypothesized 30 seconds increase or difference as compared to medical therapy in patients treated with PCI in exercise tolerance. At the end, I managed to demonstrate 16. But still, I mean, the endpoint was at 6 months, but failed to show a benefit in terms of quality of life of PCI. In this session, the subgroup will be focused on the 1/3 of the population which had an FFR of actually above 80. Meaning that these patients did not have hemodynamically significant lesions. So I think it might be interesting to see if this overall concept of non-inferiority prevails there, or in this case, that it does show a difference.
But if I might or may make an expectation, my gut feeling tells me that okay, in the 70% of the patients with an FFR below 0.80 or an IFR below 0.89, you might expect that PCI will be better, whereas in the other group with an FFR above 0.80 or an IFR above 0.89, probably medical therapy should prevail. But that's interesting because I think the concept of coronary physiology will be tested here, but there's more in that session, right?
Yeah, so interesting. In the same session there's also more on physiology, namely the 5-year results of FAME2 will be presented. And to me this is interesting because at 3 years there was a strong trend, or there was a trend towards a lower rate of death and MI in the patients treated with PCI as compared to OMT. And I'm really interested to see if this trend really is still present at 5 years, might become significant. In the same session, to answer the same question, there's an important meta-analysis, I think, which deserves to be mentioned by Zimmerman, who will pool a large series of large randomized FFR trials with the aim to address the exact same question. Will FFR-guided PCI result in an improvement of death and MI rates? So definitely something to follow on day one of PCR.
Yeah, well, the last session that particular day will be on bioresorbable scaffolds, and I'm a little bit puzzled there because first there are some presentations on new bioresorbable scaffolds, but there's also a lot of new information on bioresorbable vascular scaffolds, BVS. And then, you know, from one perspective, I'm thinking, well, so what's the point? Because I mean, we already know that at up to 3 years, it's just not good enough, and it doesn't live up to the expectations and is not as performant as our current generation drug-eluting stents. So why bother with more studies on BVS? But I think there is also another perspective.
Well, I agree. I think there's still a lot of focus on long-term follow-up of BVS with a device that is actually no longer recommended to be used in daily clinical practice. So that is an important issue. On the other hand, I think the long-term follow-up is interesting, specifically from a scientific point of view and also from a patient point of view. Still 125,000 patients have been treated with these devices. So to me, that already warrants the fact that long-term follow-up should be pursued. For a device that is actually meant to dissolve within 5 years. So it could be that even after 5 years might become, might appear interesting findings.
Yeah. What about Biosolve 4?
Yeah, so in the same session, focus on Biosolve 4, to me also something that deserves attention since it's the largest registry in a McMaras device to date. So the McMaras is a magnesium scaffold which is designed to dissolve up to 1 year, an iteration of Dream's first and second generation, which has been tortured by reports of early recall in the past year. This study will focus on the clinical performance in a large series of patients. Unfortunately, the trial will focus only on the first 200, so we need to keep that in mind. And I'm not so sure whether there will be data on invasive imaging, because to me that still is very important in the evaluation of the performance of these new devices.
I definitely agree, and it's also in line with the recent BRS consensus statement that we do need invasive imaging follow-up when we are dealing with a current generation BRS and new technology there.
Yep.
Okay, so the next day, May 23rd, Wednesday.
So May 23rd starts with a spotlight session on mitral and tricuspid interventions, and the first study to be mentioned maybe is Maverick.
Yeah, so that stands out to me because it's a very attractive, sexy technology. It works with a T-bar in the coronary sinus, and a septal closure device in the atrium septum, and both structures are then connected with some chordal structure through magnetic technology. It's very interesting. The 6 months follow-up data were presented at TCT, the last TCT, and at 6 months 40% of the patients had an MR grade 2 or more. It's going to be interesting to see and learn how it looks like at 1 year, because I'm not so sure whether the coronary sinus is the
place to go
and is a valid target for percutaneous mitral repair. But you might be wrong, and so that's why I think it's definitely a study to keep a track on.
So Wednesday continues with a second hotline session on TAVI.
Yeah, and I think there are a couple of trials standing out. The first one is the Notion trial. So there will be some data available on the longevity of transcatheter valves versus surgical valves, and it will be one of the first one to report on that. Then there's also a sub-study from the Sentinel trial, and I'm very much in cerebral embolic protection, because I think brain injury and the protection of brain injury and TAVI is essential, especially if we are moving to lower risk patients and younger patients. And I'm more in favor of the seatbelt analogy. Well, this particular sub-study will look into predictors. Can we identify the patients based on anatomy who would benefit from the Sentinel? We'll see. And then there is also the MicroPort VitaFlow trial that will present 1 year results. And this is an interesting study. It will be presented by Thomas Modin, but it deals on 111 patients from China. And all patients were treated in China. So probably Thomas also learned to speak Chinese
we'll see
lately, but I think it's going to be an interesting study, because it's the first self-expanding technology outside of Centera with also a motorized handling, and it's more like a self-expanding system like Portico, Core Valve and Evolute. So it's going to be interesting to see how it behaves. And then we know from the 30-day results that over 20% of the patients have mild PVL, and then 2% have moderate PVL. So how is that going to look at 1 year? Do we see an improvement over time, like we have seen with Core Valve, or does it remain stable, or does it deteriorate? So interesting. interesting stuff coming up in that regard.
Yeah, looking forward.
But then that same day there is also a whole session on renal denervation. So is there a revival on the topic now?
So to me, the renal denervation session on Wednesday will be one of the more interesting sessions of the meeting, with a focus on two very important studies that could have tremendous implications for how this field will move forward. I agree with you, 4 years ago renal denervation was close to death after the publication of the H10.3 results. A revival might have been initiated after the publication of the OFMED results of Medtronic, published last year, in which the investigators really did an important attempt to optimize the patient study, so in order to optimize the study population, be more efficacious in terms of procedural aspects, with more denervations per patient, and no longer a focus on patients that also might have had isolated systolic hypertension. So in today's session at PCR, a focus on the HTN ONMED trial, which will follow patients with a dedicated triple therapy drug combination for resistant hypertension, as well as patients studied in the RADIANT SOLO study, in this case with the RECO Paradise system, focusing on patients off med with an endpoint at 2 months. So I'm very curious to see what will come out of here.
So what do you think? Will renal denervation gain some momentum from these trials?
Well, I think renal denervation will be part of our armamentarium in several years from now.
Good. And then finally, to wrap up the second day, there is also a session on latest generation drug-eluting stents, predominantly on bioresorbable polymers. So what is your take on bioresorbable polymers? Are they just another drug-eluting stent, or is it the next generation drug-eluting stent? What is your take on that?
Well, I think it's good to look back into history a little bit and realize that drug-eluting or bioresorbable polymers have been part of our daily armamentarium already since many years, and were actually designed to tackle one of the hurdles of the first generation drug-eluting stents, with issues raised in 2005. Today we are 13 years down the line. I've seen meta-analysis on the fact that bioresorbable polymers on drug-eluting stents actually do not result in superior outcomes, potentially with the only difference in stent thrombosis at the long run. So at this year's PCR, again, some focus on long-term bioresorbable polymer DES studies. As such, the Dissolve 3 will be presented, looking at the 2-year results of the mice stent, and also the Century 2, which will present the final 5-year follow-up of the actually very well-performing Ultimaster at 2 years. So we have to see what happens at 5 years, but also here I do not expect major changes.
Okay, that's going to be an exciting second day. On the third day of EuroPCR, the Thursday, there are again several sessions, a bit late-breaking trials. It's more a potpourri that will cover almost the entire spectrum of interventional cardiology. Of course, we will monitor that on-site, and we will report to you later on. So with that, I would like to thank you for joining us today in our preview of the EuroPCR 2018. And as mentioned earlier, we will record on-site at the end of the meeting and then see whether our expectations were valid, and we will learn hopefully what is hot and what not. So thank you very much for your attention. Thank you, Joost. Thank you.
Thank you.